Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the second phase of the government's national vaccination drive kicks off today. And amid allegations of dropping off the ball on a supposed 50 million syringe deal, the health department assures of enough syringe supply in the country. And later, at least 63 countries now detect the Omicron COVID-19 variant. How is the government beefing up measures over its possible entry? Health spokesperson Maria Rosario Vergeire joins us live. The second wave of the government's nationwide vaccination drive starts today. All eligible individuals are invited to get inoculated against COVID-19 from today until Friday. Public and private employees will also be excused from work. The health department is calling for volunteers for the vaccination team and data management group. The three-day campaign comes as the country prepares for the possible entry of the potentially more transmissible Omicron variant. Only 6 regions will take part in this week's vaccine drive. These are called the Cordillera Administrative Region, Metro Manila, Ilocos Region, Cagayan Valley, Central Luzon, and Calabarzon. But even with fewer participating regions, the health department says the goal of vaccinating 7 million people remains. Other regions will take part in the vaccination days next week. The government postponed this week's schedule in these areas as these are along the path of severe tropical storm Odette. Ahead of today's vaccination drive, over 8.2 million doses of vaccines arrived in the country yesterday. This is the largest single-day deliveries of vaccines so far. Over 10 million doses are also expected to be delivered today.
Most of these vaccines that we will be having right now will be given to those regions with low vaccination coverage. And particularly those vulnerable persons, yung hindi pa natin nakukuha na more or less 3 million na A2, yung senior citizens and those people with comorbidities. So yung priority natin to sa Johnson & Johnson's are the areas of BARM, Region 5, Region 12, and other areas in Davao City and also sa island ng Tawi-Tawi, Sulu, Basilan, and other islands in the areas of Bicol.
This is a unique window of opportunity we have to protect as many of the vulnerable people as possible so that they are better protected when the Omicron variant eventually arrives here. We urge the government and the LGUs to use these vaccines to protect the most vulnerable and that way save as many Filipino lives as possible.
And let's go straight to the source of the story. We have health spokesperson Maria Rosario Vergeire. Yusek Vergeire, welcome back to the source. Thank you so much for your time. All right. A connection problem right there, but Undersecretary Maria Rosario Vergeire already available. We're going to try that again. Yusek, this is Pinky Webb. Can you hear me?
Yes, good morning, ma'am.
Okay, thank you for your time, Yusek. So the second round of the national vaccination again begins today, Wednesday, Thursday, and Friday. Although, of course, we already know that in some regions po, hindi matutuloy. That's 11 regions because of Typhoon Odette. Is the target still 7 million for the remaining regions?
The 7 million target, ma'am, would be for the whole country. So it was divided and allocated according to the capacity of each region and the number of unvaccinated individuals.
I was speaking to Dr. Abea Singha, and he was saying that we really need to look for the vulnerable sector. This would be, obviously, he said, the A2 priority, which are the seniors and those with comorbidities. Paano ho kaya government will be able to encourage? I heard a number of about 3 million. Is this true?
Yes, Pinky, no? So we were able to identify regions and areas with the lowest coverage or among unvaccinated vulnerable individuals. So we have deployed our teams. We have deployed more teams into these areas, and we have identified areas that we are really going to be intensifying our vaccination. We will be trying to sweep, no, or map out all of these unvaccinated vulnerables in these areas that we have identified.
Okay, so a lot of focus, no? But Yusek, would you be able to tell us what is the problem with this number of 3 million that government really needs to focus on? Was it because hindi po nakarating ang bakuna sa kanila, or is it hesitancy, or would it be a combination of both?
Well, unang-una, ma'am, pag tinignan natin, we tried to analyze and we saw that there is really hesitancy among these groups of the sectors involved. Pag tinignan ho natin, there is brand preference. The second would still be misinformation, especially among our senior citizens. So we intensified our information campaign, and this time around, pagpunta natin dun sa mga areas na identified namin with the lowest coverage, we will be trying to go to the ground. Titignan natin kung makakapunta tayo sa mga komunidad para maibigay natin ng diretso talaga sa ating mga senior citizens itong mga bakunang ito.
Dadali na po sa kanila this time around. Sila na po ang hahanapin ng bakuna.
Yes,
Sila na
ma'am.
yung
No? So
pupuntahan.
I think this is very important at this point, especially with the threat of these new variants coming.
All right. And then, so that is the plan for Wednesday, Thursday, and Friday. Unfortunately, because of Odette, there are some regions where vaccination has been canceled, and this will be moved to next week. Ano po, hopefully by that time, wala na po itong bagyo. But for now, concentrating on these 3 days in the areas in 6 regions, there was a call from government for volunteers. Do you have enough manpower for the 6 regions for the 3-day vaccination drive?
Actually, for these 6 regions that we have started with December 15 to 17, volunteers really are there. No? So ang amin po talagang hiling would be for the other regions, especially in areas where there are really no doctors in Maguindanao, in Negros Occidental. We tried purposively inviting our medical societies, our volunteer doctors para dun po sila pumunta dahil ito po ang kakulangan natin. But for these initial 6 regions, our volunteers are there and we are prepared already and we are going to the ground already.
Okay, so it doesn't seem like there are challenges this time around in terms of manpower, vaccine supply, because everything is already set in place. There were 8 million doses that actually arrived yesterday, and I believe 10 million will also be arriving today. So that's 18 million in 2 days. Sabi ko nga earlier, Yusek, yesterday was the biggest single day delivery. So how much vaccines do we have?
Well, we already have about 140 plus million doses delivered to the country out of the committed deliveries. So pag tinignan ho natin, sobra-sobra na ho yung bakuna natin. So we are still trying to encourage everybody to get their vaccines, even their booster doses. No, kasi po meron na ho tayong oversupply sa ngayon. Pag tinignan natin, hindi na po kakulangan ang bakuna dito sa ating bansa.
It's nice to hear that word, no, oversupply. Marami po tayong bakuna ngayon. Okay, but in relation to that is this question and this allegation of dropping the ball regarding the issue of syringe or yung mga hiringgilya. If you can and if you know, Yusek, will you be able to explain this to us? Nagkaroon ho ba talaga ng dropping of the ball as alleged by Secretary Locsin with regards to this syringe?
Actually, ma'am, there is really no issue, no, from the part of DOH. When we heard about this, we immediately, no, tried to retrieve all of our documents and the coordination that we have done. This supplier has been coordinating with us, and we have gone through the usual process of DOH in terms of suppliers requesting, no, or offering their supplies to us. So we revert them to our procurement service because us as end users cannot communicate with them because that is a violation of the law. So with this, he was offering that they can offer syringes. So we tried to accept them as part of the pool of suppliers that will be bidding for this 0.5 ml syringes. But when we gave them the request for quotations and the ABC, they were saying that we were offering too low a price for these specific syringes. But we cannot go beyond what is written in our ABC because that would be a violation of the Procurement Act. So we explained it to him. So we do not have any information as to why they were saying that we have dropped the ball because we have coordinated with the supplier from the very first time that they have communicated with us. And just to be clear to everybody, we are not procuring 0.3 ml syringes because these 0.3 ml syringes for Pfizer, we already have an order through UNICEF and it's going to be delivered already. And some of this had been delivered. What we have right now is an emergency procurement for the 0.5 ml. These are for the other vaccines. And this is being processed already, wherein this specific supplier in question has been included into the part of the pool of suppliers that we have requested for quotations.
There are two types of syringe in terms of ml that need to be used for our vaccines, USEC. So there's a 0.3 and a 0.5. From what I understood from you, 0.3 is for Pfizer and 0.5 is for the rest. Would that be correct?
Yes, ma'am. There are two types of these syringes that we use. It's the 0.3 and the 0.5. And 0.3 is specific to Pfizer vaccines.
And yung 0.3 po, hindi ho ba nagka-problema tayo dyan in the past with regards to the syringe for Pfizer? And now, that's not a problem anymore.
Oh, well, there is still a problem because there is this global shortage of this type of vaccines. That's why even though we were able to place our orders already and paid for this 44 million through UNICEF, we still have not received the entire bulk of the orders because of this global shortage. So we will be receiving most of this in the early part of 2022. What we have right now would be that we have identified an alternative syringe to be used so that we can still utilize the Pfizer vaccines that we have. We have identified the 1cc syringes and the tuberculin syringes. We have downloaded funds to our regional offices so that they can procure this type of syringes so that we can use the Pfizer vaccines.
I see. So there are even alternative to this 0.3 ml for Pfizer kasi hindi pa ho lahat dumadating. And has there been a problem with the LGUs, the local governments, procuring this alternative syringe for Pfizer, or do they have enough?
There had been these issues, local governments having this type of vaccines. But what we did for us to ensure that supplies will be there, we have downloaded funds to our regional offices. So they will be procuring and distributing to our local governments.
I see. Okay. It's the regional offices of the DOH, obviously, that will have to procure this alternative syringe and distribute them to the local government units. But let me get a clear answer. I'm not sure I got it right. Do we have enough syringe or the alternative for Pfizer for these 3 days of vaccination and next week's 3-day vaccination drive as well?
Yes, ma'am, we have enough because as I've said a while ago, deliveries for this 0.3 ml syringes from UNICEF came. We received initially 3.6 million and then the rest will be coming. I think it came last night. It's about 400,000 syringes. So this is a total of 4 million that we have distributed to the different areas. Plus, we are utilizing also the alternative syringes. So we have sufficient supplies for these national vaccination days.
And also just to go back to this allegation of Secretary Locsin, yung dropping of the ball, and we're talking about 0.3 and 0.5 ml syringes. This particular proposal in question was offering 0.5. Tama ho ba and not 0.3?
Yes, ma'am. At the outset, they were trying to just offer syringes, no, in general. And then when we told them that we are not procuring the 0.3 ml syringes, we told them that we are going to include them as part of the pool of suppliers for the 0.5 ml syringes.
Got
Actually,
it.
this is an unsolicited proposal. No, we don't do that because we have to put out first the information, and then suppliers will provide us
Yeah.
with their quotations. But this time, they were coordinating with us ahead, no? Ahead without the information yet.
Okay, next up, we're going to talk about Omicron, the latest on this. Has this been detected in the country? But we need to take a very short break. The source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, health spokesperson Maria Rosario Vergeire. Yusek, before we go to Omicron, you mentioned a while ago that we have an oversupply, over 140 million vaccines. Are you seeing any potential problems when it comes to, number one, storage? And the second one would be spoilage of the vaccines.
For now, we do not see this kind of issue because as soon as vaccines arrive, we immediately distribute them, not to our local units. So the storage here, the central storage, is not really a problem. We provide our local governments immediately these vaccines. Second would be if the spoilage, no? So depends, no? So because we are also accepting donations, and most of these donations have shorter shelf lives. Or the expiries, no, of these vaccines that we receive from donations sometimes are shorter than the usual that we procure. But right now, the FDA is working with our manufacturers for the extension of shelf life. So these manufacturers are reevaluating their products and trying to see if their vaccines can still be extended as to the shelf lives of this, and it can still be effective. And some of the manufacturers already have applied and had been approved, like Pfizer. We have extended the shelf life already. Sinovac, we have extended. So we're just waiting
Really?
for AstraZeneca and the others.
Really? So if, for example, it says, or the shelf life would be December of 2021, there has been an approval to what? Extend this by a month or 2 months?
Yes, actually, for Pfizer, it was extended for another 6 months. No? So meron pong ganun. Ano? So ito po, pinag-aaralan uli ng mga manufacturers. They go back to their laboratories and try to see if they extend the shelf life of their product, if it's still going to be effective for the individuals who's going to receive this. So it has been proven already. Pfizer has extended. We're waiting for AstraZeneca. We have initial information that certain batches of this product, no, can be extended. But up until now, we have not received yet the EUA or the revised EUA from FDA.
Would you be able to give us a number on how many vaccines in the millions have been given an extension of their shelf life? Is there a number that you can share with us?
I do not have the numbers right now, but this Pfizer extension was issued already last June of this year. So it will depend on the batches of these vaccines. No, it's not going to be the entire procurement or the entire supply that has been given to us. Specific batches of these vaccines. Okay.
Omicron, any update from the Philippine Genome Center? What was the latest batch that was genome sequenced? Because last I saw, and this could not be the update, there could be a newer one, was sometime December 9, wherein 48 samples were genome sequenced, and there was still no Omicron, and 38 of the 48 were the Delta variant.
Yes, ma'am. Up until now, we still do not have the results from the genome sequence or for the Philippine Genome Center for the latest run. But we are awaiting because it's supposed to be out by today or maybe tomorrow morning. So we will be providing information. So our latest results are still the ones from December 9.
So how many times in a week, Undersecretary, is the is the Genome Center giving out results of those that are being genome sequenced? Because remember before, during Delta, it was just once a week. Is this time around, has it been twice a week, or it's still once a week?
Yes, ma'am. No, so during in usual times, we usually do it once a week because the process takes about 5 to 7 days for bigger number of samples. But for now, because we are trying to intensify our efforts because of this Omicron, we have this smaller machine which can be able to run for about 24 to 34 hours, and the results will be out. And this is the samples can be as only a small number, like 48 samples, like what we had last December 9.
I
So
see.
what we are, yes, so we are having about 2 times results for every week. One would be the larger samples, and the other one would be the smaller samples.
So I'm assuming this one that will come out will be the larger sample, because if we were to go back to the December 9 genome sequencing, that was a small sample because that was only 48.
Yes, ma'am. No, so we have these 2 in parallel running right now. So I will still need to check what will be coming out today or tomorrow morning, if it was from the 48 samples or from the 750 samples, because we run immediately or we process immediately those coming from the returning overseas Filipinos, especially if they came from a country which is highly suspicious of having this Omicron variants.
All right. Again, we need to take a very short break. The source will be right back. Yusek, I have a few minutes left. I just wanted to get an update on those 2 passengers from South Africa who arrived in the country. Have they been located?
Up until now, ma'am, they have not been located yet. We were trying to coordinate or contact them, but they were unreachable. These 2 individuals had been also reported to their local government units already, and up until now, they cannot locate them.
Okay. How about the travel ban? We have 16 countries so far. Are you considering to include? Are you guys considering including other countries in the red list?
Well, for now, as based from the IATF discussions yesterday, the metric stays. No, so we are looking at the incidence rate or the number of new cases in each country in the world. Also, we're looking at how fast the number of cases are increasing in each of the countries. So we are using that right now, plus their testing ratio. So the presence of the Omicron is not part of the factors or the criteria into how we are classifying countries as to red countries. But we have discussed yesterday that maybe countries with local transmission already, as had been announced, will be included as part of the discussions in the coming days.
I see. How about alert levels? Are we ready to shift to alert level 1? Our cases were 250 more or less yesterday, but there were a number of labs not operational and some were not able to submit their results.
Well, we are really seeing that cases are declining, and we are really seeing that, local governments have been able to control the transmission of the COVID-19 in their areas. But for now, even though we are at alert level 2 in all of the regions of the country and areas, we are still very hesitant to give that kind of easing of restriction into alert level 1 because of the threat of the Omicron variant. So for now, we will stay at alert level 2 so that there would still be restrictions and we can still prevent the spread, if ever that Omicron is here already, of this variant among our communities.
As a last, siguro question or statement from you, Undersecretary, Christmas is coming up. We've seen a lot of gatherings. People are really coming together for get-togethers, dinners, and drinks. Please talk to the public and remind us the importance of our minimum health protocols.
Thank you very much, ma'am, for this opportunity. I would just like to remind our kababayans, Christmas is coming and we really feel the excitement of being together with our families and friends. And now that cases are declining, let us not forget that the virus is still here. We are so much into this pandemic still. Please always comply with the safety protocols. It is a very little sacrifice for us to be able to protect our families and our community. And please remember that if you are already eligible for vaccination, please have your vaccination, because this is part of our safety precaution so that we will be able to protect ourselves, protect our family, and protect the community. So this coming Christmas season, let's have this Ligtas Christmas para sa isang healthy Pilipinas. So thank you very much po, ma'am.
Yusek, in case I don't get to interview you before Christmas, I'd like to wish you and yung mga kasama niyo po dyan sa DOH ng Merry Christmas. And also, thank you so much for being available all the time. Merry Christmas to you.
Merry Christmas, ma'am, and maraming salamat po sa inyo.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.